and I'm a midwife here at Morecambe Bay Trust. This video has been created to provide you with some postnatal information for when you return home. All of the information in this video can also be found on our website. We hope you find it useful. I'm here now with Carey. Carey is a midwife here at Lancaster and she's going to talk to you about your visits once you get home and the role of the health visitor.
Hello, congratulations on the birth of your baby or babies. First of all, I would like to say that you should have a red book, and if your midwife doesn't give you one when they bring you up from delivery suite, just prompt them to give you one, alright? When you go home, we will give you a discharge pack, and inside it is lots of information. The main thing I want to draw your attention to is your postnatal care. So when you're discharged from us, a midwife will come and see you tomorrow, the day after. It may not be your named midwife, but they will try to do that. And they'll go through all signs of infection, feeding, nappy changing, call care. Any questions you've got to ask, they'll answer for you.
Your first contact with your midwife will usually be at your home. On day 5, you will see your midwife again, either at your home or at one of our postnatal clinics, which are held in both Kendal and Lancaster. Your postnatal care will be tailored to your personal needs. In addition to day 5 and 10, we will provide visits or appointments on an individualised basis, so whatever your requirements, we will be there.
They will then see you on day 10 as long as everything's alright with the weight of your baby. If your baby's lost a little bit too much weight, then we'll just come in about day 8 and weigh the baby again just to make sure everything's okay. Now, as long as you're happy, the midwife will discharge you around day 10 to 14, which is when your health visitor will then come and see you. Hopefully you've all met your health visitors antenatally, and if you've got other children, hopefully it'll be the same health visitor as you've had before. They will then come and see you, make sure everything's alright, and we'll discuss with you when you can get your baby weighed, which clinics are available, and all different things like baby massage classes and mums and babies classes as well. So that's everything I've got to tell you about your discharge, and congratulations again.
On your baby's 5th day, your community midwife will perform the newborn blood spot test, sometimes referred to as the heel prick test. If you read the screening information leaflet given to you at the start of your pregnancy, this will explain the procedure in detail. The newborn blood spot tests for 9 different genetic disorders. We do the test nice and early so that if treatment is required, we can start this as soon as possible. For our ladies who've had a caesarean section, what kind of things do they need to be looking out for?
So we need to make sure you're keeping your wound dressings on for at least 5 days. Obviously sometimes those come off sooner than that. Just make sure the area is kept clean and dry, and get your community midwife to have a look at those.
What about signs of infection then? What sort of symptoms do we need to be aware of?
Okay, so you need to look out for any red hot areas, any oozing of the wound site. If you start feeling unwell, particularly like flu-like symptoms, and if you get an increase in pain in that area, then obviously give us a shout.
So on the note of pain, what is the best medication for women to take once they go home?
So the best medication you could take we've got right here. So you can have your ibuprofen, which you can take 3 times a day, and you can have your paracetamol, which you take 4 times a day. Now the best thing to do is alternate them and not take both at the same time, and then that will help you get through that.
Okay, so our ladies who've had a vaginal delivery and might have some stitches down below, how do they keep that area clean? Because it's not easy, is it?
No, it's not easy to keep that area clean and dry, but as much as possible, so showering or bathing once or twice a day, making sure you wash your hands before and after going to the toilet and before and after changing pads, and make sure you change your pads regular.
That's brilliant. Great.
Okay.
Yeah, thank you. Thanks, Jodie.
So safe sleep is very important for you and for your baby. Your baby should always be placed in your room in his or her own cot or Moses basket for at least the first 6 months of their life. This has been shown to reduce the risk of sudden infant death syndrome or cot death. Your baby should lie in her cot, flat on her back, with her feet to the foot of the cot. This is so that she can't wriggle down underneath any covers. Any blankets that you're using should be folded just once and should come no higher than baby's armpits, and they should be tucked in firmly and securely around your baby so that she can't move and wriggle underneath them. We don't recommend swaddling your baby, however we do appreciate some babies will only settle when being swaddled. It's important that if your baby has to be swaddled to settle, that you keep a close eye on your baby. Some of you may have been aware of a study that came out of America regarding the use of dummies for safer sleep to reduce the risk of cot death. This was a large study, but the evidence is not of the best quality. And currently we do not recommend using a dummy to reduce the risk of cot death.
Always place your baby on their back to sleep. Use a firm, flat, waterproof mattress. Never sleep on a sofa or armchair with your baby. Don't sleep in the same bed as your baby if you smoke, have had alcohol or drugs, or if your baby was premature or of low birth weight. All babies should be in a rear-facing car seat until the age of 15 months. It is illegal to place a rear-facing car seat in the front if the airbag is active. Research has shown that babies are safest when sleeping flat on their backs. Therefore, car seats should be used for travel only, not for routine sleep.
The most important factor in successful breastfeeding is good positioning and attachment. To attach your baby to the breast, let baby tilt his or her head back. As their mouth opens wide, the chin and jaw move forward and should touch the breast first. Then you should swiftly bring your baby onto the breast so they take a large mouthful of breast tissue. Key signs that you have a successful and comfortable position and attachment for breastfeeding result in a non-painful feed. Their jaw should move rhythmically as they suck and swallow. There will be rapid sucking initially and then long, deep, rhythmical sucks and swallows with short pauses. When baby is finished feeding, they will detach themselves spontaneously. Other ways to tell whether breastfeeding is going well are to monitor your baby's nappies. In the first 48 hours, your baby is likely to only have 2 or 3 wet nappies a day, but by day 5, there should be at least 6 wet nappies a day.
The changing colour and consistency of your baby's poo can be a good indicator of effective feeding, whether breast or formula feeding. For pictures, videos and information, please see the Changing Baby's Nappy link located within the maternity leaflets section on the MBHT website.
Weight gain will vary from baby to baby, but they should have regained their birth weight by around 2 weeks old. Common issues with breastfeeding may include sore and cracked nipples, blocked ducts, or more uncommonly, a condition called mastitis, where an infection has developed in the breast. Sore and cracked nipples and blocked ducts are a sign that feeding may not be as effective, and you should revisit your positioning and attachment with your midwife or health visitor. For more information about breastfeeding support groups available in your area, you will have a handout in your discharge pack. There are also a number of websites or apps that you can use to gain information and watch videos about how to ensure effective breastfeeding.
Hello, my name is Michelle Littlejohn and I'm here today to talk to you about the safe preparation of infant formula feeds. So equipment you'll need for formula feeding is a bottle brush, your infant formula and also sterilising equipment.
Please ensure you refer to the instructions supplied with your sterilising equipment, as there are a variety of products available and differ considerably.
So before you prepare your formula feed, it's really important that your hands and work surfaces are clean. So once your hands and your work surfaces are clean, we're going to empty the kettle, fill it with a litre of fresh water and use that within half an hour of boiling. It's really important that the water is over 70 degrees in order to kill any harmful bacteria which may be in the powder. It's really important that you take a look at the instructions of how to prepare your formula feed, as different manufacturers may alter the way the formula is prepared. Make sure you use the scoop that comes with that formula feed, as different formulas use different size scoops. Too little powder will not provide your baby with the nutrients they need. Making up a feed with too much powder may make your baby ill. For example, they may get constipated or dehydrated.
Please be aware of latest guidance which advises against making up batches of bottles. Each bottle should be individually made prior to each feed to ensure no harmful bacteria has opportunity to develop.
Remember to cool the formula prior to giving it to baby, and you can do this by running it under a cold tap. Just make sure that the water doesn't go near the lid. Before giving the formula to the baby, test it on your wrist to make sure it's the right temperature. When you're feeding baby, make sure that you're sitting comfortably. Hold baby nice and close to you and look into their eyes when they're feeding. This helps baby to feel safe and loved.
Feeding your baby responsively enables you to bond with your baby and should be seen as an opportunity to provide love and reassurance, as well as meeting his or her nutritional needs.
When baby does not want any more feed, hold them upright and gently rub their back. This will help to bring up any wind. Thanks for watching, and for more information, don't forget you can check out our maternity website where you'll have all the leaflets available.
For further unbiased evidence-based information regarding formula feeding, please look at the First Steps Nutrition Trust website. So I'm back with Jen, and we're going to talk a little bit now about your postnatal mental health.
Thanks, Helena. So I think first of all it's important to acknowledge that pregnancy is definitely a wonderful and happy time for most of us, but it can also be a time of anxiety. Depression and anxiety are the most common mental health problems in pregnancy. They affect about 1 in 4 women in pregnancy and up to 1 in 10 dads and partners. I think it's important to acknowledge women need emotional support both during pregnancy and importantly afterwards.
So what is the difference, Jen, between baby blues and postnatal depression? What are the different signs and symptoms?
Yeah, okay, so the signs and symptoms are usually really similar. Baby blues normally last sort of 1 to 2 weeks following the birth of the baby. And these are short-term feelings which, although they seem bleak at the time, don't necessarily mean you're going to go on to develop postnatal depression. But it can begin at any point in the first year of the baby being born. Some signs and symptoms of postnatal depression can include kind of persistent sadness, feeling fed up, can't face the day, persistent low mood, lack of enjoyment in the things that you used to enjoy, so that might be your favourite TV show or going for a walk with your dog. They also include things like difficulty bonding with your baby and withdrawing contact from your friends and family. And sometimes these kind of also manifest themselves as kind of negative thoughts, so I'm not good enough and my baby doesn't like me.
But I suppose sometimes maybe the people that are most likely to pick up on these differences might not be yourself, but it might be your partner or the grandparents.
Yeah, friends and family often pick these things up. So some signs that you might spot in yourself or even in your partner, if you think your partner might be suffering. If they're not eating, if they're kind of not aware of the passage of time, so not knowing if they've been sat somewhere for 10 minutes or 2 hours, or wondering where the day's gone. And I think the important thing is that you discuss these concerns with your family, with your midwife, your health visitor or your GP. We understand that this is a daunting time and we would never ever judge anyone for raising a concern about their mental health. What we might ask someone to do is maybe complete some specialised questionnaires to assess the degree of the anxiety or depression that you may or may not be suffering from. And what's important here is that you're really honest when you're filling in these questionnaires. We're not here to take your baby away from you. You're not a bad parent for asking for help or support, but being honest allows us to put the correct support in place for you and your family.
Okay, so once you've been to your GP or spoken to your midwife, what kinds of treatments might they recommend, do you think?
So we might start really simply just by looking at a post-birth wellbeing plan, and all your community midwives should have these readily available.
These will look at small changes that you can make to improve your mental health and the way that you cope with things. It might be getting out and getting some fresh air, it might be making some time for yourself, making sure you have someone to take the baby while you have a bath or just sit for 10 minutes with a book in peace and quiet. It might be that we refer you to therapy services, or in conjunction with your GP you might want to consider some medications to treat your depression if you're diagnosed.
So the baby blues and postnatal depression are unfortunately relatively common, but there are other conditions which are a little bit more serious, aren't there?
Yes, so pregnancy and birth can trigger some more serious mental health conditions. Conditions such as bipolar disorder, post-traumatic stress disorder and postpartum psychosis. So these can all cause significant changes in your behaviour and your mood, but these can all be managed successfully with the right support in place. And that's why it's important that you don't hesitate to ask for the help and support that you need around your mental health.
If you find yourself experiencing any of these or similar symptoms, please remember you are not alone and there are people waiting to help you. So Jen, where else can people look to for more information about this?
So absolutely, there's a wealth of information out there. What I would say is stick to trusted sources such as the NHS website, Tommy's Mental Health and Wellbeing website. There are also some apps about mindfulness and things like that women and their partners and families can look at. But I would always say speak to a health professional about your mental health concerns.
Brilliant, thank you. In addition to the support your midwife, health visitor and GP can give you, we also offer a service called Listen with Mother. Listen with Mother is for anyone who would like to discuss their previous or future birth experiences. If you feel you need to talk about your birth experience, have unanswered questions, or would like to discuss options for your next birth, please consider this service. To make an appointment, speak to your community midwife who will arrange this for you. You are legally required to register the birth of your baby or babies within 42 days of birth. If you had your baby in Lancashire, you will be able to register the birth of your baby in any registry office in Lancashire by booking an appointment online or calling the registry office direct. If your baby was born in Cumbria, you are required to register your baby in a Cumbrian registry office and can make your appointment by the same method.
One of the first things to do is register your new baby as a patient with your GP. At the same time as you do this, you can make your appointment for your 6-week follow-up check. At your 6-week check, your GP will do a full top-to-toe check with you, including your blood pressure, making sure that you're feeling fit and well, and discuss your mental health with you. And your GP will also want to check that any wounds and stitches have healed correctly. They might also want to discuss with you contraception, so it's important you've thought about what you want to do for your family planning. The GP will also have a look at your records and see whether you're due a postnatal smear. It's really important that you go for your cervical smears.
We hope you found this information useful, and all that is left for me to say now is many congratulations on your new arrival and best of luck with the next step.